Welcome to the Ward 1 Community Meeting for Monday, November 13th, 2023. My name is Bernie Schultz, and I'm the Ward 1 City Councilor. Tonight we have Health Department Director Steve Curry on the end there, and Fire Chief Dante Suarez sitting next to me, who will make presentations and then answer questions. I did say about the notice this time that, you know, although we talk a lot about Ward 1 issues, of course, because this is a Ward 1 meeting, that sometimes we talk about things that apply to the whole city. So I just want everybody to know that, so that sometimes if they have questions they'd like to ask our guests, they could definitely come to the Ward 1 community meeting. So let's get started with Fire Chief Dante Suarez. He's got something he'd like to tell us about the fire department and the little reorganization that's taking place.
That's right. Thank you, Councilor. Thank you very much. So this is a change that recently happened. This change came about with the help of the council and the mayor, and it was something that I think was really important that needed to be done for the fire department, and that was to create, I shouldn't say create because that's not the right word, but to take our day captain and have him become a deputy chief for a few important reasons. And that was a position that was in place when I got on in 1995, and after the downturn in the economy in 2008 was taken away. With the help, as I said, from the council, the mayor, we were able to place this position back to a deputy chief, and you know, it was really important. I thought something that I was really happy to see happen. So the three main reasons why we needed this position to become a deputy was because of continuity of operations, chain of command, and a seamless transfer into the chief's position. I'll speak on each of these and what they mean to us. And first is continuity of operations. That continuity of operations is basically who's the second in charge. This is something that is done in all aspects of our society, from the military to businesses to government, and it's that important. That's why everybody does it. And basically what it is that we know exactly who's in charge of that agency if anything were ever to happen to the person that is in charge. You know, we have it in, when you see the president, if he were to get sick or anything like that, it would be the vice president that would take over. In the fire department, we have 4 deputies, and each of those deputies was basically the second in command at any given day. The problem with that is that we don't have one that is dedicated in that role. So during the course of the week, we would have up to 4 different people that could have been second in charge, and that can create issues if an emergency arises and we need to really pinpoint and contact that person. The other issue too is sometimes if that deputy has a day off for, just say, a vacation or something like that, his day captain, his shift captain, takes over as out-of-grade deputy. So now you have a captain in that position making the same, trying to make the same kind of decisions that a deputy would, and he might not have the delegated authority to do that like the deputy himself would. So putting that deputy, that second in command deputy, we know exactly who's second in charge every day of the week, 365. And if there's any situation where we can't get a hold of the chief, we need to make a phone call. All it takes is one extra phone call. You get that other person, and we know exactly who can answer our questions. The second issue that we had was what we call chain of command. And basically it says that delegated authority moves from the top down. So the Fitchburg Fire Department, most fire departments are a paramilitary organization. So we know that the orders would go from the chief to the deputy down to the captains and so on. When we had the captain, the day captain in charge of FEMA, who also does our training, now he's the highest trained in FEMA matters. As we know, we've been having these storms. They're getting more intense and more frequent, like we did on July 16th. On that day, our FEMA captain was more or less in charge of that storm. Now he's telling deputies or trying to give orders to a person that's got a higher rank than him. That doesn't fall very well, especially with the federal government. Chain of command is something that they use, and if there was ever an issue at one of these storms where somebody got hurt or worse, you know, that could come back to bite us, because, you know, there are government agencies like NIOSH and OSHA who will perform an investigation. And one of the things that they'll find is that chain of command was not followed, and that could be a liability generally for the department, but for the city itself. And then lastly is a seamless transfer to the chief's position. As I said, I got on in 95, so I've been on the fire department for 28 years. As a private, you learn the lieutenant's positions by working out of grade. When I was promoted to a lieutenant, you would do the captain's position out of grade. And as a captain, you would do the deputy's positions out of grade. The one position where nobody really practices is the chief's position. We could argue that it's probably one of the most important positions on the fire department, and nobody's really practicing the roles and responsibilities of that position. So with this deputy now in the day position, he's an assistant to the chief and second in command. Not only does he do his FEMA position and also training for the department, but he's also going to learn the roles and responsibilities of the chief's office. So if there was anything ever to happen, just say for a health reason, as one example to the chief, we have that person that's going to step right in. And he can also take over once the chief retires. In a perfect model, that person will be training in the chief's role for 1 or 2 years. Once the chief retires, he can just seamlessly step right into that, which would be a nice smooth transition, not only for the department, but for the city itself. Another way we could use that position too is if somebody's newly appointed to chief and this person is in that role for a year or two, he can assist the chief as his assistant with the roles and responsibilities. Some of the things that he would be learning would be yearly budgets, how to bring agendas to the council, hiring of personnel through civil service, creating, implementing, and enforcing policy, commanding emergency events, payroll billing, and applying and managing federal grants. As I said, this was a position that was back in 95 when I got hired. It went away in 2008 after the downturn, but with the help of the council and the mayor, we were fortunately to get it back, and I'm really proud of that. If anyone has any questions, I'd be more than happy to answer them.
Chief, I guess the big question would be, when is this all going to take place? Is it immediate, or is it in the spring or next year sometime?
No, so this position is in place right now.
It's in place.
It is in place right now, yep.
Okay. Any other questions for the chief?
Well, thank you very much, Councilor, and thank you all for listening. Appreciate it. Thank you.
Thank you. Thank you, Chief. So we'll move on to Health Department Director Steve Curry, who also is the chairperson of the Montechusett Network as well, right, Steve?
That's correct, Councilor, and thank you for letting me speak this evening, and good evening, residents. I'd just like to quickly talk about some of the things that are going on in the different divisions in the department, and I will start with the housing. They sort of deal with all the nuisance complaints as well, so I kind of term it the Housing and Nuisance Complaint Division. But as we all know, in the last several months, the City Council has adopted a brand new vacant building ordinance. This division has worked very closely with the IT department. One of the requirements of the ordinance is to register vacant buildings. This new ordinance is designed to incentivize owners to not sit on vacant properties and either do something with them, rehab them, or sell them, especially some of our downtown properties. This registry will assist with that. As I stated, we work very closely with the IT department, and these folks will be able to register and conduct all registry business online. Obviously, if you're computer savvy. If you're not, we can still do it through the office, but we encourage online permitting. It's very straightforward and user-friendly. Also, just in the last week, the council has appointed a new hearing officer, which is an important enforcement piece to this registry, as well as many other ordinances. We look forward to having hearings before our brand new hearing officer, which should be happening within the next few weeks. We will also get, in collaboration with our community development department, and we will put some advertising out there just to let people know what's forthcoming with this new registry and explain all the ins and outs of it and how it works. Another issue that the Housing and Nuisance Complaint Division is dealing with is it's been an uptick of illegal dumping. As you may know, last November, the state of Massachusetts banned mattresses and box springs from being disposed of in landfills, so we need to get creative. Like TVs, tires, yard waste, metals, mattresses and box springs are now considered a waste ban item. Luckily, we have a brand new contract. Luckily, in the city, we have a mattress recycler. They are Tough Stuff Recycling. They are located at 145 Authority Drive. And we have signed a contract with them to assist residents. Disposal is still not free, but it now has reduced cost. There is a $22 cost to bring it to Tough Stuff. You can do that online through the city or as on the Tough Stuff website, or you can call them at 978-307-4118 for an appointment. These mattresses and box springs that are dropped off need to be in bags. So the health department is supplying bags to anybody that would like to make an appointment. The bags are free of charge, and it assists with storage if mattresses, if that's the case. Tough Stuff Recycling also has a curbside collection option, which we have signed up for. That also can be signed up for on our city health department webpage. Once we have 20 scheduled, they will go out and collect. Thus, the need for the mattress bags once again. If you give us a call, we can even mail them to you. If you need to store it for any length of time, obviously it's going to take us a week or two, maybe even longer, to rack up the 20 mattresses. But that cost is $33. It's much better than the $50 and $60 that many other communities are paying. So it's a great benefit to have Tough Stuff Recycling nearby. And then there's always the landfill drop-off. That price is now $35, and obviously that is to incentivize. The landfill cannot deposit in the landfill, so they also have a contract with Tough Stuff. So you can cut out the middleman and go straight to Tough Stuff and pay a reduced cost. These funds and these reductions in fees all became part of possibility from a grant from Mass DEP, and that's called the Sustainable Material Recycling Grant. One other thing I'd like to mention about the housing team is they continue to work with our legal team within the city, as well as the State Attorney General's office. They work on vacant and abandoned buildings and trying to restore those properties and get owners to again, either rehab or move on these properties. And since 2015, we have restored over 80 properties in the city back to the tax rolls, and many of them are now occupied. I will now move to should I take questions on each individual division, or should I just finish and?
Yeah, just finish.
Okay.
You can
So we also have a nursing or an epidemiology division. That unit contains our vaccination team. They are currently holding COVID and flu clinics throughout the 13 communities of the Montezut Public Health Network. We did have a flu and COVID clinic at our senior center this morning from 9 to 12. And they did one at the PACC in Gardner this afternoon, which was quite busy. But folks are encouraged if they are looking for a clinic. It's a very busy schedule. They can call 978-602-2356 and find a clinic that's close by, or even schedule one if you'd like to have one in your own facility. We've also received a bunch of new test kits for COVID. They are free and available for giveaway in our department as supplies last. It's a nice chunk, and it should be able to get us to spring if there is a need. And just to mention, our disease investigation team also investigates all reportable diseases for Fitchburg and the 12 communities in the network. So they've been pretty busy during the summer with foodborne illnesses, and now we get the respiratory diseases of the winter months. So, different division. I'm going to jump to the waste and disposal division. As folks know by now, we do have a new trash and yard waste collection hauler. E.L. Harvey has taken over in July. They're doing quite well. I mean, still learning the streets and intricacies of the city of Fitchburg, but they're getting there. Waste management still collects our recycling in the city. Just to mention another interesting something that's happened in the department in the last year. With collaboration of Brown and Caldwell, the engineering, along with Wind Waste, who is running AKS Recycling off of Airport Road, which is Cobbler Drive. The city owns a landfill over there that was operated in 1968 to 1971. We have submitted a plan to the Department of Environmental Protection for groundwater monitors, gas monitors at the landfill site. So kind of a big step there for the city to comply with current regulations as far as old closed landfills. I'm also excited to announce that construction has begun on the Fitchburg Westminster landfill. They have been approved to expand in elevation. This expansion will get us another 6 years at least as we continue to negotiate how we will expand beyond 2030. Still in the works. I know the Fitchburg Westminster landfill has experienced some odors in the past several months, sometimes unbearable. I just want to let you know that the landfill is working quite expeditiously, I should say, for permitting. Most of the reason of the odors was due to the wet season that we experienced over the summer, which really affected the leachate system and all our ground monitoring. So they are working on permitting, as I mentioned, and to install gas piping and leachate piping to help reduce the odors and take away all the extra moisture that the landfill experienced over the summer. I'd like to remind residents that Recollect is on our webpage. Recollect is a trash app in the city. You can download it on your smartphone if you have one through Google Play or the Apple Store. You can also go to our website. You do not need a smartphone to sign up for it. You can use a landline. It is a trash calendar. It tells you when yard waste collection is. Oftentimes, I get 1,000 calls a week that no trash or no yard waste collection was taken care of, or your yard waste wasn't picked up. Well, we did not have yard waste collection last week, but this week it resumed. So I know there's a lot of yard waste out there, but it is scheduled for this week. This app or calendar, however you wish to utilize it, is a handy tool to know when yard waste collection is, and so that the yard waste doesn't sit out there in our inclement weather for extended amount of time. As you know, the bags don't hold up in heavy rains. Right now, there's over 9,000 people signed up on it. A little less than 400,000 people have used it, or 400,000 people have viewed it. Obviously, one person has done it more than once, but 6,000 people in the city have printed a calendar, and 41,000 people have viewed the site for a very first time. So people are using it, and I encourage to continue to expand on that. As folks know, in August, we upgraded our landfill permitting system. Permits now contain a barcode system, and permits are scanned at the landfill to better, quicker access at the landfill, quicker approval, as well as you now do not need to change your permit annually. We can electronically renew them through the barcode. So hopefully that will be an online process and make renewal much quicker. As far as the admin end of the health department, this summer we hired a new weights and measures inspectors. He actually began his duties in January, but had to cover landfill for approximately 6 to 7 months. But now, good evening. But now he is learning his weights and measures duties. As folks wonder what that position does, it basically goes out and looks at our gas pumps and our scales in grocery stores and various weighing equipment to make sure that what the weight or the scale says is actually what the consumer is receiving. It's a mandated position by the state. The state actually did it since 2004 when we had a retirement in the city. The position was never filled, but it became a burden on the state, and they could no longer keep up with Fitchburg as it was growing. So Peter DeLorme has taken over the duties, and he so far has done an excellent job. He will be working to become certified as a weights and measures inspector. Probably take about a year of training to get him to that point where he can take the exam to be certified. But he's doing an excellent job, and we're glad to have him. We also have added an additional clerk, Laura Wade. She has adapted very well to the office, and now she is accepting additional grant duties as she's paid by grants. So she will be reviewing all the grants. There's upwards of 10 or 12 grants in the department, so she will be overseeing those grants, making sure that the deliverables are met, as well as the financial piece of it. So both Peter and Laura have been an excellent and tremendous help and asset to the department. Our food inspector has been with us a couple of months now, Sean Michael Tantanarowat. He has adjusted quite well. He hit the ground running right from the start during a difficult time in our pandemic, but he continues to utilize open.gov for streamlining of permitting and of all our eating establishments. And he as well has been a great addition to the department, and he accepts and picks up tasks quite quickly. And then finally, we have the Street Outreach and Prevention Division. That consists of Sue Christensen as well as Keith Barnaby. They continue to work with our unhoused population, and they also assist with our substance abuse issues in the city as well. They go out on the field. They work very hard at conducting Narcan trainings and distributing Narcan and providing our unhoused populations with connections to the resources they need, and getting many people off the streets and into housing within the city. Some of the services that they include, as I mentioned, housing assistance, as well as connections to detox, treatment, and connections to behavior and mental health, as well as recovery support and harm reduction activities. And our outreach team continues to offer non-judgmental assistance while closely collaborating with our many agencies to ensure that there's effective and efficient referrals in place to those agencies and needs of the clients. And that's my list.
Everybody ready for the snow up here? It's coming down?
Yeah, we saw that on the way in. I didn't bring my shovel.
questions for Steve? Jacqueline?
Yeah, so you mentioned illegal dumping, and this past summer, some community activists discovered that asphalt was being buried on Caldwell Street, and the response initially from the city was, no, it's not being buried. Then photo and video evidence was provided that it was being buried and covered over with pebbles. And the DEP came out to do an investigation, and we still have not gotten closure on this. My fellow activist here had sent an email saying, I kindly request your assistance in elucidating the procedural steps entailed in the eventual removal of the asphalt, as well as the permissible duration for which it can be safely stored underground. Can you answer that, since the DEP is not?
The DEP is not?
No, they have not responded.
So the construction of asphalt is, that was an old DPW site back in 30s, I believe. It was an area they used for storage of materials. The asphalt that was laid down is no different than a resident constructing a driveway. So they have constructed a DPW storage site where they store their road grinds and various equipments. It's construction of a driveway as well as land for storing of materials. It's
temporary. How long or is it going to be stored there? Because it seems like it's going to be there forever, which is against the law.
DPWs are exempt from site assignment. DPWs are allowed to store materials that are used for road repairs. That material that you are looking at, I do know is a very expensive material. I guarantee you that they will be utilizing that material in any paving duties that they encounter.
Because it's my understanding, having looked through the public records provided by the DEP, that it's supposed to be ground up into little pieces and...
So, yeah, they're not supposed to have grindings above 6 inches in size, I believe. We have addressed that with the DPW commissioner, and they will be working on making sure that that doesn't happen, and any other material that is an issue, they will work on to correct it.
And do you have a timeline for when that will be completed?
I believe they're working on it already.
There's no timeline or deadline for them to complete that.
This is it's not a major issue. We'll monitor it as we go, and I'm sure the DPW will gladly comply and take care of the issue.
Steve, I had a question about COVID. How prevalent is COVID? You know, a lot of people have been talking about it making it come back. And I had it for the first time last month. I went to my high school reunion, and it was a pretty good super spreader event, as you well know. So I'm just wondering what the
Yeah, it's hard to measure COVID. I mean, obviously, the numbers are up. Right now, due to home tests, it's very hard to measure it because it's not reportable any longer. So it's hard to get an idea, but our wastewater testing that's going on is definitely showing a spike. And usually when that shows a spike, the numbers pick up as far as cases. And we are seeing some deaths, actually 3 in the last month, in the city as COVID as a result of a cause of death. So it's tough to put a number on it, but it's definitely rising.
So people should be washing their hands and
Washing
sanitizing.
hands, and if getting vaccinated if it's possible.
Yeah. Once you get it, you have to wait a couple months before
You do have to
get
wait upwards of 90 days to get a vaccination if you had it. That's recommended, yes.
Okay. Any other questions for Steve? Jacqueline, you have another question?
I do. So we have a new mayor-elect, and one thing she campaigned on was reducing the local regulatory burden on businesses. Our Board of Health has a very bad reputation in this regard, and I'm wondering if you plan to work with her to make Fitchburg more business-friendly, if you're going to stay where you are but try to undermine and sabotage those efforts, or if you plan to lead the employment of the city of Fitchburg.
Can you repeat the question, please?
Yes. Do you plan to work with the mayor-elect to make Fitchburg more business-friendly, to stay but try to undermine and sabotage her efforts, or to lead the employment of the city of Fitchburg?
So, we will continue to work with the mayor. I believe our food inspector has done a tremendous job working very diligently to work with all of our businesses to guide them to compliance. He is actually very good at it. There are occasions when it gets a little difficult and heated, but we will work in conjunction with old mayor, new mayor, whomever it is, councilors. We will try to be as business-friendly as possible.
Steve, I had a question about the recycling. You know, a lot of people say that, you know, this single stream, that a lot of that recycling material that Waste Management picks up doesn't really get recycled, that it goes into the landfill. What kind of...
Too many of them that put plastic
bags in and so on. What can we do to combat that, Steve?
So, as earlier I mentioned, Recollect. If you have a question, Recollect can help determine if something is recycling or if it's trash. We have upwards of about a 60% contamination rate in our recycling, which means 60% of it is trash, and 40% of it is valuable, which makes for difficult disposal. Recycling never goes to the landfill. It's not allowed. Our recycling actually goes to Harvey, ironically, and it's Harvey is separating out the trash. Someday that's become an issue. It has for many communities. But management companies will start charging if the recycling continues to be a contamination problem. So I encourage folks. I know sometimes recycling is difficult, but learn what is recycling. Bags, plastic bags are definitely grocery bags are definitely the number one item that is contributing to the contamination. And we ask residents to be vigilant to learn the system the best they can and utilize the tool if there is a question about an item, whether it's recycling or not.
With the app, they can find out. And put in whatever they have and see if this is recyclable or not.
We used to do quite a bit of separating in years before it became single stream, you know, with the newspapers and so on and so forth. You know.
Well, single stream made things too simple, and now it's too easy to throw
trash in
things
there.
into the recycling bin. It was a great invention at the time, but now it's really become a problem, and I wonder if the day's coming where we go back to the old way of separating things out.
Yeah, something to consider, I guess. Any other questions? Jacqueline has another question. One more question, and then we'll call it a night.
So, according to the IT director, we spend $10,405.39 a year on C-Click Fix. I know I've had issues with it. Other people have as well. DPW Commissioner Erickson emailed me this year, July 12th. I personally don't like the software either. I find it cumbersome and buggy. I would prefer phone calls or something that works better. And do you also support getting rid of C-Click Fix and saving the taxpayers over $10,000 a year?
I do not support the removal of C-Click Fix. I think C-Click Fix has become a great avenue to reach departments as needed. I think the $10,000 is a small price for residents to be able to place a complaint 24/7. I understand that the responses aren't always what you what you wish, or the timelines and the responses aren't what you wish, but I can receive a lot more complaints through C-Click Fix and address those complaints much quicker than telephone calls. Just my personal opinion, for what it's worth.
Well, we do get a lot of C-Click-Fix requests for illegal dumping. As you mentioned, there's a lot of illegal dumping that goes on in this city, which we really need to address. And C-Click-Fix at least gets us where we know about it. And I've put in many requests where residents of Ward 1 have contacted me and said that that they don't know what the app is and so on, so they would like me to address it. But that information does go. It's just maybe it's more of the trying to group all these things together and get them all to the right person. I guess maybe that software could be adapted a little bit for that purpose. I don't know.
Most common complaint is missed trash.
Yes.
Oh, yeah.
I see that daily pop up.
And if those were all phone calls, there's no way we could deal with that.
One thing we do have to remind people, Steve, is that, it's very difficult to put your trash out in the morning, the day of. If you put it out in the night, I've been doing it for years, I've really never had a problem with any of the contractors by doing that. And, sometimes you forget and you do have to do it in the morning, but if you do it at night,
Recommendation
you have
is-
much more success.
Yes, 6:30 a.m. they start, so, and
yes.
I would not get into any routine where I hear it a lot that they come at 10 a.m. for the last 13 years. I wouldn't rely on that. I mean, they're forever adjusting the routes to make it more user-friendly for themselves, and that they can finish the routes in a quicker time. So, make sure it's out by 6:30 a.m. is the best advice there.
Yeah. And the night before, you'll always succeed. Any other questions for either the fire chief or, well, Jacqueline, you've had 3 chances. Let's see if anybody else has a question. Anybody else in the audience have a question?
Do we have contracts with Harvey and with Waste Management?
Yes.
So when is the recycling one up? Because it's Harvey is new.
The recycling contract is part of the landfill contract. So that is basically, right now it's 2024 or upon capacity of the landfill.
But you mentioned the other night at the city council meeting, they can't have a contract for more than 25 years?
Correct.
Yeah.
So there was a contract signed at the landfill in 1992, and it was amended and restated in 2010.
So once it's amended, then it's 25 years from that point. Yeah.
I'll ask a question.
Mary Jean.
Chief Shores, you can have any questions. I don't want you to feel left out.
Thank you very much. I appreciate that, Mary.
All right, so I'm in labor and I call the ambulance. Do you take me to Worcester? You take me to Leominster? Can I go to Hayward? Where do I go?
No, actually, we just had a labor call the other day, and we ended up, firefighters along with the MedStar EMTs, ended up delivering the baby in the ambulance, and they brought her to Leominster Hospital.
So again, my question is, can I say, please bring me to Worcester? Can I say, bring me to Hayward?
You can.
You can. So you can decide where you're going to go when an ambulance picks you up.
You can.
Okay.
Good question, though.
It's important.
Yes, it is important to know.
And if you bring the baby, if you go to Leominster, do they come pick up with the transport, bring the mother and the baby to Worcester? How does that happen?
Can you repeat that question?
You said you delivered a baby, you brought him to Leominster?
Correct.
Leominster can't handle infants. What happens? They get sent to the transport to bring the person to Worcester?
They do.
So the person waits in the Leominster hospital with the baby?
They do.
Oh my gosh. Couldn't you just bring them right to the Worcester hospital?
We could. So you got to understand, too, that the Leominster ER is set up. They don't have a maternity ward, but they're set up to receive babies and pregnant mothers.
All emergency rooms have to receive babies. I mean, that would be
Correct.
common sense, but
have they done additional steps? Do they have neo-neo, can they have incubators, do they have?
As far as I'm aware, they have all that equipment. They just do not have the maternity ward. Sure.
Of course, the hope is that we'll have a regional birthing center at some point in this area, in the Fitchburg-Leominster area. I don't know if that's going to happen, but...
Freestanding building.
Freestanding.
They're looking for freestanding buildings.
All right. Thank you, Chief, for
Thank you
coming
very
out
much,
tonight,
Counselor.
and
Thank you, everybody. Yeah.
for Health Department Director Steve Curry as well.
Thank you, Counselor.
Very informative, going through all the divisions, and I'm sure everybody wanted to know about the reorganization and that second in command. So thank you very much. And the next meeting will be held on Monday, December 11th at 6:30, right here in the Legislative Building. And Human Resources Director Susan Davis will make a presentation and answer questions. So it'll probably be a Human Resources night in December. Thank you all for coming, and good night.
Thank you.